So guys, we have already discussed about Pinna, its structure, development and developmental disorders. So now we will discuss about disorders that are not related to development. So totally we have 5 conditions. So coming to the first one, perichondritis. So we know the cartilage is made up of, Pinna is made up of cartilage throughout except for lobule where we pierce for earrings. So here the cartilage will be congested, and as there is no cartilage in lobule, it will be spared. So there will be inflammation. Perichondritis. Itis means inflammation. So the whole of the pinna will be inflamed except for in the lobule, and it is mostly due to piercing injuries. Then the most common organism that causes perichondritis is Pseudomonas. So when Pseudomonas is the causative organism, the drug that we use is ciprofloxacin. Okay, so with that we have completed our first disorder. Now coming to the second one, that is hematoma. So what do you mean by hematoma when it comes to pinna? So hematoma is the collection of blood between the cartilage and perichondrium in pinna. So what happens? What is the pathology? There is a trauma to the pinna, and then perichondrium rubs on cartilage, and then there is leakage of blood and hematoma occurs. So how do we manage? We manage by doing aspiration and contour dressing. What do you mean by contour dressing? By applying pressure. Okay. Coming to the third condition. The third condition is cauliflower ear. Here what happens is there is repeated injury, repeated trauma to the pinna. So there will be cartilage proliferation and chondroblast invasion in hematoma. So it is otherwise called as wrestler's ear or boxer's ear or pugilistic ear, because wrestlers and boxers tend to have repeated injuries in the ear. So it is due to repeated trauma, that is why they have such a name. Now coming to the fourth disorder. Fourth disease is chondrodermatitis nodularis helicis. So everything about the disease is there within the name. Chondro meaning cartilage. So the issue is with the cartilage. Dermatitis affecting skin. Nodularis. So there is a presence of nodule in this disease. And helicis. Helicis means the most common site is helix or anti-helix of the pinna. So chondrodermatitis nodularis helicis. Now it actually requires no more further explanation. It is presence of nodule either in the helix or anti-helix. Then the cause is pressure and temperature changes due to less padding or less insulation in the pinna. So how do we manage? If there is less padding, means we will support with cushion. So provide apply cushioning, or while we rest with the ear, always maintain a cushion. That's it. Then so the cause is pressure and temperature changes. An age group that is most commonly being affected is middle age or elderly. Okay. Now coming to keloid. So when does a keloid happen? Always following a surgery or following a healing. So here also it is similar to that only. There is abnormal proliferation of fibroblasts following some surgery. Then the cause is iatrogenic trauma. Then what are the features of a keloid? It will be firm, rubbery, and then it extends beyond the margin of the scar. Then how do we manage? We manage by applying either. So the first line management will be interlesional steroids. We apply with steroids. Now what if the keloid is a bit large? For larger keloids, along with intralesional steroids, we do surgical excision. Then what if there is multiple keloids? If there is multiple keloids, we treat it with radiotherapy or cryotherapy. Okay. Now next one, the last disorder of pinna is sebaceous cyst. Sebaceous cyst, unlike keloid is firm and rubbery. Here it will be soft and compressible. That is how you differentiate. The second feature of differentiation will be, this will be following a healing, but this will occur otherwise, and here management is surgical excision. So thank you.